All right, we're going to go ahead and get started because we have lots of great things to cover today, and I want to be cognizant of everybody's time. So like I mentioned, I'm Megan Ockett. I am the program director with Healthy Birthday, Inc., and I'm so excited that you're here today. Hopefully you see my entire presentation. Feel free to chat me in the box to make sure you can hear me. I would love to know where you're from in South Carolina. We're based in Iowa, and so it's really nice to get a landscape, an eye for the landscape of where everybody comes geographically. I'd love to know what organization you represent and where you're at in South Carolina. So go ahead and use that chat box and let me know if you have questions throughout. We'll have time at the end to answer questions, but I think it's important to track those questions as you think of them so we don't lose those. So at first, I would really like to thank the South Department of Health and Environmental Control. It is because of a partnership with them that we are able to have this presentation, that we are able to bring you these free evidence-based educational materials about stillbirth prevention. And so just a huge shout out to the South Carolina Department of Health and Environmental Control. So happy to be partnered with them. And so with that, I'm going to go ahead and turn off my video because we have a couple of videos to show and it helps with kind of the broadband issue of it. So I'm going to do that. Okay. Let's go ahead and get started. So obviously here's my contact information again. If you have any questions after the presentation, feel free to email me. I'm always grateful and thankful to hear from everybody that works on the ground that's educating expectant parents about this. I think it's highly, highly valuable and important, and you help us do this great work. And so my background is in public health. I have been with the organization for a little over 2 years. And prior to that, I worked for Iowa Department of Public Health. Like I said, we're based in Iowa. And my true passion is maternal and child health. I love working in this organization. I love the passion behind it. I love the fact that it's empowering, and I really love the systems change and the fact that we can truly integrate this into systems, into your current workflow. We're going to talk through that a little bit later on, but that's something I really, really want you to think about as we move throughout this presentation of how can you take this and integrate it into your workflow so that it's easy to remember, easy to talk about. And so before we get too much further, I always like to play a short video. And I play this video for a couple of reasons. I like to play it because one, it does a really good overview of giving you a good idea of really what Count the Kicks is, what it's all about in a short amount of time. Two, it's a feel-good story, right? It's about a baby that was saved when her mom spoke up about reduced fetal movement and baby was delivered healthy. And then three, I also like to share it because I might reference a couple of the talking points that the mom references throughout this presentation. So I might go back to this a little bit. Four, this is a really good video that you can find on our YouTube channel. You can find on our website. It does a really good job of showing you the power of that mom-to-mom storytelling, because when this aired on Good Morning America in 2017, we saw a huge spike in our app downloads. And so we know that mom-to-mom storytelling is important. So anytime you can share a story like this is what resonates with expectant parents. And so with that, I'm going to go ahead and hit play.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the ECOFs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Yeah. So baby Ruby is famous. That's kind of what we joke. We have a picture of her in a little shirt that says famous. And so now that you have that background, we know, and you know, hopefully, Count the Kicks is a highly effective evidence-based stillbirth prevention campaign. We have developed an early warning system for mom, and we're saving 1 in 3 at-risk babies here in Iowa. I'll talk about that data in just a little bit, but our campaign is ready to go. It's low cost. It's no cost for you. The South Carolina Department of Health and Environmental Control has really removed that barrier, even though our materials, you know, they're free. We have these webinars, we have online trainings. And so I highly, highly recommend that you take advantage of all of these different tools at your disposal. So before I go too much further, I just want to make sure that we're all on the same page when it comes to definitions and terminology. And I think the majority of you, if not all of you, are medical providers. So I think this is just a refresher, if you will. But what we're talking about today is stillbirth. And stillbirth is a loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, 23,500 babies are born still every year in the United States. A miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. And then there's infant mortality, and that is the death of an infant before his or her first birthday. On average, around 22,000 infants die every year in the United States. And so one thing that I want to draw your attention to is that we're losing just as many babies, slightly higher to stillbirth than to infant mortality. Yet stillbirth is rarely talked about, right? It's very taboo. We understand it's sad. It's, you know, nobody wants to talk about it, but we have to talk about it. We have got to talk about stillbirth and prevention of stillbirth in order to change those numbers. The fact that it is just as prevalent as infant mortality, yet nobody talks much about, is not okay. And we need to change that. And so what we want to do today is give you the tools and resources of how you can talk about it with your patients and clients, and then feel comfortable talking about it, and then showing them ways to potentially prevent preventable stillbirths. And so here are some of the causes of stillbirth, some of the likely causes. This is based off this research study that you see on your screen. We have a lot of great evidence and research on our website. So if that interests you, by all means, absolutely go to our website and click on evidence, and you will see a whole page dedicated to it. So I'm not going to go into details of the causes of stillbirth because we're really talking about the prevention, right? But I just wanted to throw this on for you, that pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, like you heard about Ruby, medical complications in the mother. I know a hot topic is COVID and pregnancy. And so I think that's one thing to keep in mind, is that we really want pregnant women to be vaccinated because of these numbers that we're hearing about infections and stillbirths out of COVID positive expectant women. And so we're actually having a presentation here right after this one about COVID and pregnancy, a national one. So hopefully you have been notified about that. And so let's look a little bit closer about the data. 1 in 169 pregnancies, and this is national, end in stillbirth. So like I said, 23,500, around 23,000. And the racial disparities are huge. Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterpart. Hispanic moms, it's 1 in 199. Indigenous women, 1 in 138. White women, it's 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. So let's drill down a little bit further and look specifically at South Carolina. So the stillbirth rate on average is 6.84 per 1,000 live births in South Carolina. So that's a 5-year average taken from CDC Wonder. So unfortunately, South Carolina is in the top 10 for the highest stillbirth rate. The national average is 5.96. 1 out of 130 pregnancies in South Carolina will end in stillbirth. So basically, South Carolina loses approximately 395 babies to stillbirth every single year. And when we talk about we're saving 1 in 3 at-risk babies, if we take that and do the math, that would be about 136 babies that could potentially be saved from preventable stillbirth by educating them on the importance of tracking fetal movement and speaking up. So when I talk a lot about that evidence and that 1 in 3 babies in Iowa, this is what I mean. And so you can see here on the chart, and I know it's kind of small, but the teal dot is the Iowa stillbirth rate by year. And then you can see the dashed or the dotted line is the trend. And then the red line is the national average. And so if you look at that, Iowa, we're on a downward trend for stillbirth rate. Count the Kicks, Healthy Birthday was created in 2008. You can see that's where we were at the highest for stillbirth rates. And so over the past years, 10, 11 years, we've seen about a 32% reduction in the numbers in the stillbirth rate here in Iowa. And public health officials have said, there wasn't anything else really going on that would have made such an impact on the stillbirth rate in Iowa. It's not like smoking dramatically decreased among the 3rd trimester. In fact, that has increased. Obesity has increased. That's another risk factor. Or it's not like every expectant woman received a doula care. That would be amazing, and we know would truly impact the stillbirth rate. And so public health officials have said that that's really what they really feel like this public health campaign has helped with that 32% reduction. There are some outlier years, like you can see 2017 and 2019, things like a syphilis outbreak or COVID, a pandemic, and that affects the baby and mom. And so things like that, that's why we're really looking at the trend. We're looking at 3-year averages and things like that. But so I just want to share how we get that 32% reduction. In the first 5 years of the campaign, we saw almost a 39% reduction among African-American women. And so we're excited to bring this to South Carolina. So let's take a moment, because I think this is very, very important to talk about why there are such racial disparities among Black women being at such an increased risk of stillbirth, and really understanding the why, and then thinking about how you can help change that within the system and within your community. So researchers point to the following as causes for these disparities. So systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and all that comes with that has led to real and pervasive health issues for Black women. Those epigenetics, physiological variations that are caused by external or environmental factors, switching genes on and off, and how the DNA sequence is read over time and cells are read has changed. Predisposition to certain conditions like gestational diabetes, preeclampsia, all linked to maternal stress. And experts say Black women are less likely than other races to receive early treatment. So ensuring that we're getting prenatal care early is essential. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose a baby than a high school educated white woman. So what are we doing to help reduce these disparities, and what can you do? We have a health equity coordinator on staff. We have made this a priority. It is a laser focus of our organization. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're improving programming based on lived experiences of women of color and working within marginalized communities. We're working with our state partner, just like the South Carolina Department of Health and Environmental Control. We are placing billboards in areas with high stillbirth rates and with high areas of marginalized communities. So talking through the data and looking at cases or areas that we need to focus more attention on is key. We have an app that we'll talk about soon in 12 languages. We have culturally appropriate educational material. And then we have videos, printed educational materials, and FAQs in multiple languages, among other things. So now that you know a little bit more about the data, you know a little bit more about the facts, the terminology, how is this evidence-based and research-based? And so I want to spend a couple moments talking about the research behind this campaign and how it all got started. And so if you don't love research articles, but I really encourage you to read at least one, this is the one I want you to read. This is the one that started it all. And so this was a public health research study out of Norway. And so how we were founded by 5 Central Iowa women, all who lost babies in the early 2000s from either stillbirth or infant mortality. They did not know each other at the time. We're all in Central Iowa. They were actually told by their providers that stillbirth's not that common. It doesn't happen very often, but as they got connected and they were grieving together, they got connected by pastors and friends. What they started to realize was this is a lot more common than people think. Here we sit, 5 Central Iowa women who all experience this, who are all within a relatively short time frame. And so one of the first things they did is they wanted to work with the legislature and get a stillbirth registry. And so that's exactly what they did. They got a stillbirth registry with CDC funding to be able to track trends in stillbirth in Iowa. And it was because of that stillbirth registry that they were asked to go speak at a stillbirth conference in like 2007. So it was at this conference where they spoke, and as they were listening to a couple other researchers talk about upcoming manuscripts out and things like that, they heard about this public health research that was done out of Norway. And Dr. Ruth Fretz, who's circled there, she's also now on our medical advisory board, but she was one of the researchers of this study. And what it showed was when women were educated on the importance of tracking fetal movement in the 3rd trimester and how to speak up to their providers if they noticed a concern, that lives were saved. Basically, they saw about a 30% reduction in the number of stillbirths among this cohort of women who were educated. And so these women, these founders of Central Iowa said, that's amazing. Like how simple and easy and low cost, we can do this. We can bring this back to Iowa. Great things start here. Let's do this. So they came back to Iowa with this research, and they had created a plan. They worked with Iowa Department of Public Health and a local marketing company, and they found other research that we'll talk about here in a minute. But basically what they did is they created the Count the Kicks campaign. So kick counting has been around forever, right? But there hasn't been a true effort on this, a true campaign about the importance of tracking fetal movement and how to speak up. And so what they wanted to do is they wanted to ensure nobody would join their circle. Nobody would lose a baby. They had one goal, to save just one baby. Never in a million years did they think that this would turn into a national organization that has saved, that we know about, close to 100 babies, probably more that we don't know about, has an app, is in several other states, et cetera. Their goal was to save one baby, and look where we're at now, just by educating expectant parents, by giving providers the tools and resources of how to have this conversation, and then giving parents empowerment of how to speak up and know what's normal for their baby. So I took this quote from this research, and it says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. So we were also named best practice by the Association of Maternal Child Health Programs, or AMCHIMP. They do a scientific review determining, what programs are engaging stakeholders at all levels of practice. And like I mentioned earlier, I'm very passionate about systems change, systems level change. And so that's one of the things they look at, as well as being able to be replicated, making sure equity is at the center of it. And so we were named a best practice in January 2021. And then I think we've all heard of the CDC Hear Her campaign. And I really want to point out that as part of the Hear Her campaign to reduce maternal mortality in the US, the CDC lists 15 urgent warning signs, and the importance of paying attention to baby's movement is one of the key markers. And then just quickly, a couple other things that I wanted to stress that, some people think about as I'm talking about this, that this is just going to increase anxiety, that I'm just going to get all these calls from these pregnant women. And that's really, truly not the case. Here's a quote from one study. It says, one potential side effect of routine monitoring fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. Because if you think about it, you have fully educated expectant parents on how to track their baby's movement. And then they have real data in their hands and know when to speak up if they need to speak up. We have also done our own research with the Des Moines University and the Harkin Institute, and we have found through our app users that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. They had stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, and that preliminary research shows that the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And then there's other additional benefits. There's the reduction of preterm birth rate, fetal growth restrictions identified earlier. You can read all of these different journal research articles on our website. I think what's really important to know is that this is a checkpoint for expectant parents and babies. This is just part of the health plan, right? They notice reduced fetal movement and they go in and they work with their provider to go through further testing to see if everything's okay. That's what it is. We want highly educated women to understand what's normal for their baby. I think it's also really important to note that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have had live births. So their maternal morbidity and stillbirth are intrinsically connected. If we can help prevent stillbirths, we have the potential of saving the mom's life as well. So this is one of my favorite quotes where it says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So like I said, we have a whole page dedicated to this type of research. Here's some additional articles, and I will send this out after this PowerPoint will be sent out along with a link to our website. So you'll be able to access all of these. So, all right, let's kind of get into the meat of it, right? Like, what is Count the Kicks? How do you do it? What is it? How's the app work? Obviously, it's a stillbirth prevention public campaign. I've said it time and time again, it's evidence-based, it's mom focused. We educate women on the importance of tracking fetal movement through the use of our mobile app, which we'll talk about in a minute, or paper charts that we have available on our website. What I love, love, love about this campaign is it truly empowers moms to speak up to their providers if there's a concern. And if you look at the material, and when we're talking about stillbirth, you might think it should be dark, it should be, dreary, but it's bright, it's colorful, it's positive. And that's exactly what the founders wanted. They wanted an uplifting, empowering campaign that really spoke to expectant parents, and that was inclusive. There's no race identified on our materials like this. And so you can easily see that it's inclusive. So this is probably the only presentation you will ever be at that will show you or tell you, please take out your phones. I want you to take out your phone and I want you to go to your app store, whether it's the Google Play Store or the Apple Store. And I want you to just search Count the Kicks. And then I want you to download this. It's free. It's in 12 languages. And I want you to download it because I want you to become familiar with it. I want you to be able to use it and see how easy it is to use So then in turn, you can go to your patients or clients and say, look how easy this is. Let's download this together and go through it once. And then let's talk about it at every single appointment. And so as you're downloading it right now, hopefully, or if you already have it, you get bonus points. Again, this is available on Apple and Android. You can see the 12 languages there. Here are a couple of the key features that I really want to point out for you. And you'll understand this as you begin to use the product. But users can restart their session or delete a kick. This is extremely valuable. I am potty training a toddler right now. And so when my 3-year-old says he has to use the potty, and if I'm in the middle of a kick session, I need to stop that kick session. I'm going to have to maybe come back to it because I need to get him to the potty. I think a lot of us can relate to that. Or deleting a kick. Let's say I'm, bonding. I have my little 3-year-old next to me and we're counting kicks together. And then he taps my phone 4 times quick or grabs it and runs. I can delete those kicks because I didn't mean to, or I just got a little tap happy and didn't think that was thought it was a movement and ended up being a hiccup or something. So you can delete those. So those are one of my 2 main, favorite features. You can also set daily reminders. And I think this is very, very important. We want you to share with your patients and clients that you want them to count daily around the same time every day. We are busy individuals. We're a busy society. So setting those reminders to notify them that it's time to count is perfect because they don't have to do a separate calendar. They can do it all within the app. They can set them up daily at whatever time they need, and they can set up multiple reminders. They can also review kick counting history. They can download the history to share with their provider, family, or friends. We use my chart here, so I can download my kick session history. I can take a screenshot of it and upload it to my chart and say, hey, look at my data. A bridge that really fills that gap, especially with COVID, where we've seen a lot of appointments go to telehealth or stretched out. This is another connection point for you as a provider to work with your patients on. You can count for singles or twins. You can track future pregnancies on the same profile, so you don't need to set up a new account for every pregnancy. And you can manage multiple devices registered to your account. So you could be counting on an iPad and your iPhone and now your smartwatch all on the same account, all linked together. Or your significant other can get on and log in and see how baby's been moving and get that data as well. We're super excited to launch our Apple smartwatch app. So you can also download this. So let's say you're lying in bed and your phone's all the way downstairs and you get that little ping on your phone for a reminder. And you say, oh, I got to count, but my phone's all the way downstairs. I'm 8 months pregnant. I don't want to move. I can just do it on my watch and it syncs directly to your phone. So we're super excited about that. That's a great feature. One feature that I really want to highlight that's new, significantly new, is the strength tracking and notes feature. So research states that not only should we be paying attention to baby's movements while counting, but also the strength of those movements. If you think back to that video with Ruby, when her mom says, I noticed her movements just felt softer. They just weren't as strong as normal. They felt weaker. That's important to pay attention to. And so after every kick session, so when mom gets those 10 kicks after she's done tapping that little footprint, she will get asked that middle screen where it says almost done. Please fill out the following fields, where she can fill out 1 through 5 feet, basically little feet. And then if you click on that little eye, it will open a box that will tell you what's on the left of your screen, where it will say, here's how you track this. One footprint tap is light, fluttery, maybe those kicks that you feel at the beginning of pregnancy, kind of like butterfly wings. And then fierce would be all movements, very strong. I think what's important to note is that there's not necessarily a right or wrong answer. It's just being aware. So that way, if I know I'm always filling out a 4 or 5 feet and that changes and I'm filling out a 1, that's a significant change. And I'm going to speak up to my provider. So then you can see on the right hand of your screen, the top is a graph. That was my baby's movement counts. And then the bottom is the strength. So you can see it kind of goes up. It took a lot longer to get those daily movements. And then the movements felt weaker. So in that respect, they correlated in this regard. That might not be the case for all of them, but I think it's important to pay attention to your strength. So just going over this with your patients is really important as well. There's also this notes feature. So they can say things like, I was gardening all day, or I walked 10 miles, or I want to tell my provider this. So they can go back to this and it can serve as a reminder. So now I wanted to share a really short video of how easy it is to use our app. Again, this is on our YouTube channel. You can take this and use it if you have TVs in your waiting room and you could play this. This would be a great thing to play or great thing to do if you're in childbirth ed classes. So let's watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Awesome. So you know about the app, you've downloaded the app, you're using it, you're playing around with it right now, so you're going to become familiar with it. So now what? How do you talk about stillbirth with expectant parents? So you might be thinking, I don't want to scare moms. And I think it's important to understand that pregnancy is full of risks that we talk to moms about. And stillbirth is another risk that moms deserve to be educated about. We do all of those testing, all those blood tests early on. This is another thing that we need to be educating expectant parents about. And I mean, not just putting a brochure in their notebook that they get when they're 8 weeks or 10 weeks pregnant and they come in for that first appointment. I mean, talking about it every single time in the 3rd trimester that you see them. Stillbirth just happens. There's nothing we can do. There can be warning signs. Reduced fetal movement is one of the earliest warning signs that baby's in distress. So when we educate expectant parents on knowing what to look for, they can speak up earlier. This is a big one, and we get this a lot from expectant parents themselves. My baby is always active. It's not a concern. And we need to remember that babies are active until they aren't. And cord and placental accidents can be sudden. And so moms need to know what's normal so that they can notice a change. And then she's almost at her due date. If you work a lot with those that live with multi-generational households or talking to their grandparents, you might get this a lot, or, babies running out of room. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. So what about talking to expectant parents who have had a stillbirth previously about fetal movement? It's the exact same protocol. You will still talk about this at every single appointment in the 3rd trimester. The biggest difference is if they're high risk, which they will be if they've already had a previous stillbirth, you should be talking to high risk expectant parents about around 26 weeks about this, 28 weeks otherwise. So you would just start this conversation earlier. So, and then feel free to talk about the previous stillbirth and to acknowledge her child that was born, especially if you weren't her provider at the time, asking about the name, the gender, staying away from medical terms like fetal demise, just truly being empathetic. And I know you all will. Asking if anybody has talked to her about the importance of tracking fetal movement. We have a lot of ambassadors that we'll talk about later, but a lot of them have said, this was maybe their 2nd or 3rd pregnancy and nobody ever told them that it was important to track fetal movement. And almost all of them have mentioned they noticed this decrease in movement before they lost their child. And so really ensuring that we're talking about it every single appointment is very important. So again, you should be doing this at 26 weeks if they're high risk, 28 weeks otherwise. How do you know about the importance of tracking your baby's movements? Or let's talk about the importance of tracking your baby's movements. Sharing how movements are jabs, rolls, pushes, anything but those hiccups. Hiccups are involuntary, like breathing, so that does not count. And then of course, sharing the app, pulling out your own phone if you want, pulling out the brochure and the app reminder card. Here in Iowa, we have to take our glucose test in the office, in the clinic setting, and then we have to sit there for an hour until our appointment. And so that is a perfect opportunity to say, okay, great, you took that awesome drink, go ahead and sit down and we'll call you back in an hour for your appointment. But here's a brochure I want you to read and an app I'd love for you to download. And then when you come back to talk to the doctor, he or she will spend a couple minutes talking to you about it. So that's a perfect time. So again, be thinking about those times that you can integrate this into your current workflow. So what are some of those common myths that you might hear from moms or even maybe your colleagues that you need to address? So here comes that active baby again, because I think you'll get this time and time again. I think you might even get it from providers in your own office. And so I think it's really important to know that even active babies can experience distress and sometimes quickly. So tracking your baby's movement every day takes that guesswork out of knowing if your normally active baby has slowed down. That Count the Kicks app gives real data to show their healthcare provider. So you don't have to think, or the parent doesn't have to think, I'm pretty sure I get it in 5 minutes or less, but now it's taking 20, 25, 30 minutes. But was it always 5 minutes or is it always around 50? They just don't have to guess. They know, they have that real data at their fingertips. So again, only those experiencing high-risk pregnancy? No, all expectant women should be doing this. We don't just do that glucose test for high-risk women, we do it for everybody. And so we want every single expectant parent you work with should be talked to about this multiple times in the 3rd trimester. Here's an old and outdated one, 10 and 2, really? It's really easy to say. So I think that's why providers really like it. I think it's really important to know that every baby is different, and the recommendation to expect 10 kicks in 2 hours is outdated. We have a research study on our website about this, because what current research indicates is that moms should work to understand what's normal amount of time each day it takes their baby to get to 10 movements. And so basically what this research study has shown is that when you put that time limit on it, that's what we as humans pay attention to. So I could be using my app or, counting, and I know my baby's normal is around 15 minutes. I get 10 movements in around 15, 20 minutes. Great. One day I count and it takes about an hour and 57 minutes. But I think to myself, no worries. I got it within 2 hours. That's totally fine. But that's a significant change, right? That's different than my baby who normally gets 10 movements in 15, 20 minutes. And so when we put that time limit on it, we really want to educate expectant parents on getting to know what's normal for their baby. And so they can speak up if they notice that change. I can just use a Doppler device to monitor my baby's well-being. A change of baby's heartbeat is one of the last things that occurs when a baby's in distress. A change in baby's movement may indicate potential problems before actual changes in the heart rate are detected. Expectant parents should only use a Doppler device under the guidance of a healthcare provider. And even then, I think you all have your own protocols of what to do. If somebody comes in with reduced fetal movement, you're doing more than just the Doppler device check, right? You're doing the NSTs and everything like that. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. Research has moved away from the idea that sugary drinks and food are a good way to get baby to move, because we want baby to move like normal without interventions like juice. So if baby isn't moving like normal, we don't want to add something to try to force baby to move. We want parents to speak up right away. Baby kicks less than near the end of pregnancy. They don't run out of room. The types of movements may change. There's more jabs, fewer rolls. A baby should move up to and even during labor. I think we all know this. This is more for those working with those that live in generational households. The movements might feel a little bit differently, but it should still take about the same amount of time to feel 10 movements. Here's that high risk one again. I just can't talk about that one enough. And then triage doesn't need this information. False. We want labor and delivery triage to have this information. Posters, brochures, we'll talk about in a little bit, but I, for example, went to triage 3 times with my daughter for various issues. Everything got checked out totally fine. But I think it's really important to know that, you know, when I got sent home, I was in my 3rd trimester. I should have also been sent home with Count the Kicks information and talking about the importance of tracking fetal movement. And so, yes, absolutely, we want labor and delivery triage to have posters, to have it in their workflow, everything like that. So what are other ways to integrate? You heard me at the beginning say that I love systems change and protocols. And so hopefully you've kind of been hearing me talk and what you can do to integrate this into your workflow. So let's talk about a few of those ways. So you can use a form and check-in. We'll show you that in a minute. You can have all front desk staff trained to ask these patients to fill out this form about fetal movement monitoring and share it with their nurse or provider. You can do the glucose test, like I said. You can integrate it into your EMR. How amazing would it be as when you're checking somebody in the patient room and you're going through all the blood pressure and everything like that. You can just have a little pop-up and have them come in and say, say, okay, 3rd trimester, talk about fetal movement monitoring. Here is what we would consider our gold standard after visit summary chart. So this is one hospital systems example. You can see where that arrow is, where it says count the kicks, and we have helped this hospital with this language. I would love to do this for you. I would love to share this with you. If you want to see this and you want me to email it to you, I'd be happy to do so. This is something that they print, and then they actually integrated our kick counting charts into their system so that they could easily print them in color. We have them in English, Spanish, and Haitian Creole, as well as information about the app. This is that form I was talking about. We're piloting this right now. If you're interested in something like this, feel free to let me know. I'd love to talk to you about what your current workflow is, what you're currently doing, and how we can add bits and pieces of this to make it easier so this becomes just easy to remember, easy to do. So then this one, if you're a community-based organization like Celebrate One in Columbus, this is an organization that works with expectant parents. They see them like once. They have one touch point with these parents. And so they have a lot of information to share at one time. They serve around 2,000 pregnant women a year, primarily Black pregnant women. And so one of the things that we added to their form that they have everybody fill out was this middle section where it talks about prenatal care, and then it talks about, have you downloaded the app, yes or no? And then we help them draft this, basically a script of what they can say or what people can read to share with their clients that come through. So this is just a quick example of how they integrated it. So be thinking of that as we're wrapping up, because I'd love to help you with any of that. So again, stress the importance of knowing their baby's normal and speaking up. Make sure all we want to hear as expectant parents is that I'm here for you. As a provider, I'm here for you. I don't care what time of day it is, call me, call the nurse line. That's what we want to do. If you can't get a hold of anybody, go to the hospital. That would be so reassuring. And that is what we have heard time and time again from our lost moms and current pregnant women, where we've done focus groups and they say, I just want to know that I'll be listened to and that they're here for me. Send a brochure home with mom and an app card, sharing that research shows evening is usually the best time to count babies' movements. I know people are busy. I know that there's a lot of different schedules out there. So really the most important thing is that they're picking a time baby's most active and sticking with that time. And then telling mom, if you're not her primary provider or her prenatal or OBGYN, make sure that, she's feeling empowered to talk to her provider about it. Say things like, you can go to your provider and say, hey, have you heard about this? I'd like to talk to you about my baby's movements. Can I show you this graph? If you're their provider, use those open-ended questions. How is tracking your baby's movements going? Can you show me your graph? What questions do you have? So as we wrap up, this is one of my favorite times because this is when we get notified that you all were listening and you went online to order materials. So again, thank you to the South Carolina Department of Health and Environmental Control. All of these awesome materials are free for you. We have promo posters in English and Spanish. Those are awesome in waiting rooms, in your restrooms, in your libraries, anywhere. The how-to posters, that's what you see on your screen right now. Those are also in English and Spanish. Those are awesome in your patient room, in your ultrasound, labor and delivery triage. And then our app card reminders. I would put those at the front desk and then check out and check in. And then of course our brochures, and it's all free. All you need to do is go to counttthekicks.org, click on order materials and click on your state and then fill your shopping cart. So that you could do that right now. I would give you leave to do that right now as I'm still talking. So this is a very fluid presentation. We also have phenomenal resources that we call our Count the Kicks ambassadors. So these are women all across the United States that are working hard to share Count the Kicks education and messaging throughout their state. You are very lucky in South Carolina. You have 2 amazing women who are your ambassadors who will stop at nothing to shout this from the rooftops. So they volunteer their own time. They can attend baby fairs. They can give presentations like this. In fact, I did a presentation with one of the ambassadors a couple months ago. They can do media interviews. They can do so much. So please, please utilize Danielle and Emily. They're phenomenal women. And this is a message from Danielle that I'd love to share with you, one of your South Carolina ambassadors.
My name is Danielle Barkley, and I lost my daughter Lydia to stillbirth in 2014. I'm currently expecting a baby boy, and as I prepare for his arrival, a lifeline for me has been the free Count the Kicks app. Every mom deserves to know about Count the Kicks and the importance of tracking fetal movement in the 3rd trimester. Research shows a change in baby's movement is the earliest and sometimes only indication that there may be an issue in a pregnancy. By using the Count the Kicks app every day to track my son's movement, I'm getting to know what is normal for him, so I can contact my healthcare provider if I notice a change. October is Pregnancy and Infant Loss Awareness Month, and Count the Kicks is partnering with the South Carolina Department of Health and Environmental Control to raise awareness about the importance of kick counting. Join us to prevent stillbirths and save babies in South Carolina by telling every expectant parent you know to download the free Count the Kicks app.
Awesome. So I am happy to report Danielle did deliver a healthy baby boy about 2 weeks ago, I think. And so these are your South Carolina ambassadors, Emily McConnell and Danielle Barkley. They also hold their own fundraiser for Count the Kicks there in South Carolina, a walk in honor of the babies that they lost. And so just a big shout out to them. They're truly amazing women and families. So they're wonderful. And then lastly, but surely not least, are baby saves. So we have over 80 baby saves and counting that we know about. So these are just women who have contacted us, who have said, I've used your app, I noticed reduced fetal movement, and I spoke up and baby's here safe because of it. We know there are countless more out there. If you have one, we'd love to do about it because we know how important that mom-to-mom storytelling is. And so here's just a few of them: Nala, Eva, Everett, and Luna. I pulled out Eva's mom, Yelly, her quote that she says in part of her story, because I love it, where she says, I'm so grateful that Count the Kicks made me aware of the importance of paying close attention to babies' movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expecting moms out there. Happy and healthy deliveries to everybody. And you have your own South Carolina baby save. This is Olivia. She actually her mom learned about Count the Kicks from Danielle. Danielle, the ambassador you just heard from. She downloaded the app. She noticed a change in movement just shy of 38 weeks. She notified her doctor, and the doctor performed an ultrasound and a biophysical following their protocol. They determined baby needed to be delivered, so mom was induced and a healthy baby was delivered, healthy daughter, Olivia. So she says, my doctor explained that the cord around her neck was likely why her movement decreased, and was just as relieved as we were to have her healthy. I will never be able to express my gratitude to Count the Kicks for teaching me the importance of truly listening to my baby. So next steps, download the app, of course, practice, mess around with it, play with it so you understand it and you can pull it out and use with your patients and clients. Make sure to share this information with your team. We have an online CE training. It's right there. You don't need to jot down the link. I'll send this all in an email to you, but this online CE training is 90 minutes and it's completely free. You can order materials, go online to our website, make sure you do that, and then you can place them around, sharing with your team members. And so with that, I'm happy to answer any questions you may have. You can use the chat box because you're automatically muted. But yeah, I'll stay on for a couple minutes, but I just want to thank you again to the South Carolina Department of Health and Environmental Control for allowing us to really be present in your state. And I am thankful for your time today. And this is being recorded, and I will send you an email with the recording, a PDF of the slides, and those links I talked about. So feel free to jot down any questions you may have. Otherwise, I hope you guys have an amazing day. Thank you.